So I just wanted to take a minute to respond to this article that got some attention in CNN last week. It was performed by some researchers at the University of Sydney and University of New South Wales. And interestingly, they did a time and motion study of 40 emergency medicine physicians just to see them in action and the processes they have to work through. And what they found was pretty interesting, that 11% of all of their tasks were actually interrupted throughout the course of the day, and 18.5% of those interrupted tasks were never returned to by those physicians. And I think this probably underlies some of the medical errors that are ongoing in the healthcare delivery process. Also, paradoxically, what they found was that physicians ended up spending less time on interrupted tasks. And once again, it leads you to believe that there are shortcuts being taken, that people will just hurry up and finish the task at hand before they get interrupted again. And once again, these are the things that probably underlie a lot of the preventable medical errors that we're seeing today. The other interesting thing they found was that doctors were multitasking 12.8% of the time. And I think I'm not sure there's a way to necessarily get rid of multitasking, especially in today's world. But as a primary care physician, I certainly have experienced this need to have to juggle multiple things at once. But it again underscores this model that we developed in the Innovator's Prescription about trying to get rid of at least some of the more routinized processes out of the day-to-day work of physicians, so that they don't necessarily have to multitask at least some of the simple things that somebody else could take off their hands. One of the ways to manage some of this multitasking that's going on is to employ some processes which have been utilized in other industries when it's absolutely essential for workers to focus on tasks at hand. And we had a chance to visit IDEO not that long ago, and they told us they had worked with Kaiser Permanente to develop secure areas for nurses to work within, as well as vests for them to wear whenever they wanted to indicate to others that they were doing something that required their concentration and they were not to be interrupted. That's something that's actually borrowed from the airline industry. When the pilots are going through their checklists in the cockpit, they are not allowed to be disturbed. And perhaps that's the sort of mentality that we need to bring into healthcare if we're ever going to have any hope of eliminating some of these preventable errors.